Hello everyone, so welcome to Pharmacist and Drugs, and in this video I'll be explaining about how local anesthetic drugs work. Well, local anesthetics are the drugs that block the conduction of impulses in the peripheral nerve system, and these drugs work by inhibiting the excitation and conduction processes, thereby blocking the sensory nerve pathway and reduces the sensitivity and causing a decrease in pain response. The most commonly used local anesthetic drugs are lidocaine and benzocaine. Both these drugs bind to the sodium channels, interfering with the initiation and conduction of nerve impulses. And for local anesthetics to be effective, they must be applied directly on the area being treated, as this ensures that a high concentration of the anesthetic will reach the target area. These local anesthetics can provide relief from painful stimuli, both short and long term, as they are able to as they take effect rapidly and can also be used in the form of sustained and released preparation. Now here we will go through the classifications of local anesthetic agents. Local anesthetics, they are divided into two classes based on the chemical structure, like amides and esters, and common examples of amide local anesthetics include lidocaine, articaine, bupivacaine, prilocaine, dibucaine, and mepivacaine. Common esters local anesthetics are benzocaine, benzoic acid, cocaine, tetracaine, para-aminobenzoic acid, chlorprocaine, procaine, and propoxycaine. Well, local anesthetics can also be classified based on the site and mode of action, which determine the speed and duration of the drug's effect. The site of action refers to the location where the drug binds to the peripheral nerves, while the mode of action is the mechanism by which the drug prevents depolarization of the nerves. And the types of drugs categorized depend on the mode and site of action, such as esters and amides, or maybe their combination. Well, again, the local anesthetics can be classified based on the route of administration. For example, topical and injectable. The topical agents include soluble agents such as cocaine, lidocaine, tetracaine, benoxynate, and insoluble agents like benzocaine and butylaminobenzoate. Injectable anesthetics drugs are lidocaine, mepivacaine, tetracaine, bupivacaine, and dibucaine. Local anesthetics can further be classified based on their duration of action. For example, procaine has the shortest duration of action, that is around less than 60 minutes or 1 hour. Articaine, lidocaine, and bupivacaine, prilocaine, and trimecaine have medium duration, around 60 to 120 minutes. Bupivacaine, tetracaine, etidocaine, and ropivacaine, they possess long durations, that is more than 120 minutes. Local anesthetics can also be classified based on the potency of drugs like low, intermediate, and high potency. The low potency drugs like procaine, intermediate potency drugs like lidocaine, mepivacaine, and high potency drugs such as tetracaine, bupivacaine, and dibucaine. These are the commonly used drugs. Now let's go through the mechanism of action of the local anesthetic drug. The local anesthetics work by blocking nerve impulses from the action potential in neurons, and they result in the temporary anesthesia. This is done by binding to and blocking the ion channel that allows sodium ions into the neuron, and these neurons are electrically charged cells whose ability to carry the signals is dependent on the generation and conduction of the action potentials, which is regulated by the movement of sodium ions, which is a process called depolarization. In the essence, the local anesthetics block the influx of sodium ions needed to generate the action potential, resulting in a localized area of anesthesia as the neurons are unable to generate signals. And depending on the duration of their action, local anesthetics are divided into two classes, short acting or long acting. The short acting agents like lidocaine are metabolized quickly, while long acting agents like bupivacaine have a longer duration of action, and they are used to create more lasting effect of anesthesia. So let's see the animated format for the mechanism of action of local anesthetic agents. In order for local anesthetics to penetrate a nerve membrane, they must be uncharged. They block the action potential from inside the membrane by binding to the receptor site of the sodium channel when charged. This disrupts the influx of sodium into the neuron and the drugs neuron, and they prevent an action potential from forming, thus blocking the signal conduction. The drugs preferentially bind to activated sodium channels, leading to a faster onset of neuronal blockade. I hope you liked this video. If you liked it, please like, share and subscribe our channel Pharmacist and Drugs.